Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss another dangerous eating disorder called bulimia. We will explore the symptoms, causes, and the impact it can have on your health, among other related topics. Make sure to watch until the end because there is very interesting information for individuals who suffer from this disorder or have a family member affected by it. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is bulimia nervosa? Bulimia nervosa, also called bulimia, is an eating disorder that causes you to eat large amounts of food at one time, binge, and then get rid of it, purge. The physical, behavioral, and emotional symptoms vary. The exact cause of bulimia is unknown. It may be a combination of genetic factors and learned behaviors. Eating disorders are potentially life-threatening mental health problems. If you have an eating disorder, you may be obsessed with food and weight. This obsession can be harmful to your physical and mental health. Bulimia nervosa can be defined as an eating disorder characterized by consuming unusually large amounts of food, binging, and then purging it. The cleanse may involve making you vomit or taking a laxative. Laxatives are drugs that increase the speed at which food moves through your body. Other features of bulimia nervosa may include abuse of water pills, diuretics, or diet pills, eating very little or nothing at all, fasting, exercising too much, and hiding food to binge and purge later. People with bulimia are usually of a normal, healthy weight. But they judge themselves harshly on the basis of their body shape and/or weight. They often have self-esteem issues that are closely related to their body image. Who is affected by bulimia nervosa? Bulimia affects more girls and younger women than older women. Teen girls between 15 and 19 and young women in their early 20s are most at risk. But eating disorders are happening more often in older women. It can also affect males. Bulimia can affect persons of any age, gender, color, ethnicity, or body type. Bulimia affects between 1% and 2% of the population each year. What is the difference between bulimia nervosa and anorexia nervosa? People with bulimia are usually of normal weight. They engage in a cycle of binge eating and purging. People with anorexia nervosa are often underweight. They starve themselves, go on extreme diets, and exercise harshly to lose weight. People with anorexia nervosa think they are fat even when they are very thin. They can be so thin that they look sick. What is the difference between bulimia and binge eating disorder? People with bulimia eat and then purge, or try to get rid of the food or the weight. People with binge eating disorder binge but they don't purge. Also, people with bulimia are usually at a weight that's right for them. Binge eaters are often overweight or obese. What are the signs and symptoms of bulimia? Bulimia nervosa can be difficult to detect. People with the disease often force-feed and disinfect in private. But empty food wrappers and laxative wrappers can be warning signs of bulimia. Other behavioral and emotional symptoms of bulimia include going to the toilet often, especially after meals, excessive exercise, concern with body image, intense fear of weight gain, depression, anxiety, or substance abuse, feeling out of control, feeling guilty or ashamed when eating, and withdrawing from society from friends and family. Physical symptoms of bulimia can include dental problems. Self-induced vomiting can cause tooth enamel to be eroded by stomach acid. Your teeth may also be pale instead of white and be more sensitive. Other physical symptoms of bulimia may include swollen cheeks or jaw, gastrointestinal problems such as constipation and acid reflux, scars, scratches, or calluses on the knuckles, from being forced to vomit, fainting, irregular menstruation, muscle weakness, blood red eyes, and dehydration. What causes bulimia nervosa? The exact cause of bulimia nervosa is not known. However, the researchers believe it could be a combination of genetics and learned behaviors. If you have a close relative with or have an eating disorder, you are at a higher risk of developing it. Popular culture and the media force people to have a certain body type. These outside influences can affect your body image and self-esteem. Additionally, feeling stressed, upset, or out of control can all lead to bulimia. What are the complications of bulimia nervosa? Bulimia can deprive your body of the nutrition it needs. Bulimia nervosa can lead to a variety of consequences, including ulcers in the throat and stomach, cavities and tooth decay, tears and inflammation of the esophagus, esophagitis, damage to the intestines and stomach, electrolyte imbalance, arrhythmia, abnormal cardiac rhythm, failure of the heart, and increased risk of suicide. How is bulimia nervosa diagnosed? To diagnose bulimia, your healthcare provider will perform a physical exam. They will ask you questions about your medical history and symptoms. You may be anxious to talk to your healthcare provider, but they want to help you get better. So it's important to be honest with your healthcare provider about your eating habits. Your healthcare provider will diagnose bulimia if you meet the following criteria. Do you repeat episodes of binge eating? Do you feel a lack of control over your eating during an episode? Do you engage in inappropriate purges? Did you binge eat at least once a week for 3 months? Does your weight or body shape have a strong influence on your self-image? There are no laboratory tests to specifically diagnose bulimia. Your healthcare provider may order tests to see how bulimia has affected your health. These tests include blood tests, urinalysis, kidney function test, and electrocardiogram, ECG. How is bulimia nervosa treated? Your healthcare provider can treat bulimia using a variety of techniques. They can refer you to a team of specialists including dietitians and mental health professionals. Treatments may include psychotherapy, nutrition tips, medicine, and support groups. How to prevent bulimia nervosa? If your family has bulimia, watch out for the warning signs so the problem can be detected early. Early treatment can break unhealthy eating habits before they become harder to fix. You can reduce your risk of bulimia by treating other conditions such as depression and anxiety disorders. Educators and parents can also teach young people that the ideal body model portrayed by the media is unrealistic. In fact, it can be unhealthy and even dangerous. What is the outlook for people with bulimia? Many people with bulimia improve after treatment and go on to lead healthy lives. Some people recover at first, then relapse and need treatment again. Statistics show that about half of people with bulimia can make a full recovery with proper treatment. Without treatment, people with bulimia can develop serious complications. Some people may need additional medical care in a hospital or treatment center. When should I ask for help? If your relationship with food causes you stress or interferes with your daily life, you may have an eating disorder. You should seek treatment immediately if you also experience any of the following symptoms: chest pain, shortness of breath, difficulty breathing, heart palpitations, dizziness, fainting, severe sore throat, or acid reflux. Many people worry about their weight. But people with bulimia are obsessed with food and weight. Bulimia nervosa is a serious illness that can affect your physical and mental health. If you think you have bulimia, don't hesitate to ask for help. With proper medical care and mental health counseling, you can get better. Take the first step to protecting your health by talking to your healthcare provider. Now, check out this video to discover some helpful tips that will assist you in achieving a healthy lifestyle. Subscribe to the channel to receive regular health tips and advice. That's all for today, and always remember to stay healthy. Thanks for watching, and we'll see you in the next video.